Good afternoon, friends. As part of our regular features in Technopark, we occasionally do have programs which are of common interest to everyone in the community. As you could expect, one of the most critical areas which need in this modern world is healthcare. And when you talk about healthcare, possibly the most important is the cardiac care. It was my good fortune that I met Dr. Shivashankaran after many years. Of course, I have known him for more than 10 years, and about a couple of weeks back, I met him in a program in the Lal Sastry Academy in Pujapura, and immediately, of course, I being a little bit selfish about utilizing such rare resources, thought that why not make use of his expertise to deliver a very relevant talk on something which is of very critical, importance to us. The incidence of heart problems, as you are aware, is very much on the rise. One of the reasons is the lifestyle of the modern world. People work under a lot of tremendous stress, both at home, at the office, in the society, and the type of in the different lifestyles which is surrounding us is possibly one reason which has contributed to this. So I thought it is very, very relevant. In fact, there was good response. And one mistake we did was we also informed that we are going to record this program and going to put it in the website. So possibly a lot of the CEOs across the world are actually waiting for it to be put in the website. That explains why there is not much of a crowd here. Otherwise, I certainly believe that everyone in the Technopark has a heart. Okay, so for today's talk, we could not have got anybody better than Dr. Shivashankaran. Dr. Shivashankaran is the professor of cardiology in the world famous Sri Chitra Tirunal Institute of Medical Sciences, Trivandrum, which is actually, it is a feather in the Trivandrum's cap, I would put it. In spite of government institutions everywhere deteriorated, this is one institute which is still holding its head high and giving top class and world class healthcare to people across the country and across different strata of the society. Rich, poor invariably get a very qualitative treatment here. Dr. Shivashankaran passed out of the Trivandrum Medical College in 1984 with the first rank and a distinction in nine subjects. I think in those days there were not too much of entertainment. That's why he was sitting and studying all the time. Subsequently, he did his MD, and of course, then he did his DM. At the same institute as in the Trivandrum Medical College, and joined the Sri Chitra Tirunal Medical Center as a faculty in the year 1994. In 2002, he was selected for a Commonwealth Scholarship Program for advanced training in pediatric cardiology at the Guy's Hospital. It's a famous hospital in London, which formed the backbone for the pediatric cardiac intervention at the institute since then. He also attended the international teaching seminar on preventive cardiology conducted by the World Heart Foundation. He was one among the 7 selected for faculty mentoring for Global Chronic Disease Prevention, NIH Fogarty program at the Rollins School of Public Health, Emory University, Atlanta, in the United States, which he successfully completed in 2010. He has published 40 papers in index journals and has received 30 awards and medals for his academic excellence. He initiated the first open heart surgical center at the backward district of Malappuram in the year 2005. Preventive and pediatric cardiology are his favorite fields of interest. He has conducted 300 lectures on diet and lifestyle to school children, resident association and doctors, and to international scientific deliberations. In fact, he qualified his CV saying, I am sending you a very brief CV. Obviously, this is a very brief CV. I am not elaborating too much into it. First of all, somebody with this much of expertise in a field, it's not every day that if you go and meet him in this hospital, it's not that easy to meet him. There will be so many patients who live in Trivandrum and across the world purely out of his mercy. For them, possibly is God also. And it's our good fortune that we could get him here. And I'm sure with his vast expertise in giving talks, and the way he would have also learned from the audience, I'm sure he'll make it very interesting for us. Normally these programs are always followed by an interactive session, but I should caution you about this interactive session with doctors. Often we in the television shows and all, people telephone over the phone and get a prescription, which is I think is ridiculous. Because unless you are examined holistically with all the information by a doctor, you can't just over a phone dial a doctor or SMS a doctor is all. I don't believe much into it. So let the queries which you make be of a general nature rather than specific to you. I was born here. I had a pain here. Pain. I don't think for that you have to go and meet him in the hospital. So that is my caution to you. But notwithstanding all these conditions, I am sure you are going in for a very, very interesting talk, very useful talk, which you should also be, because his mission is to make people understand it. And obviously he won't be able to talk to everybody around. It is our responsibility as, in the same mission mode of what he is doing, possibly we can also spread the message to across our own, friends, relatives and people around us. With these few words, first of all, my very sincere gratitude and thanks to Dr. Sivashankaran. He has spared, it is actually his valuable time. It's normally we say his valuable time, it is actually a really valuable time. I welcome Dr. Sivashankaran to this program and present him and invite him to deliver his talk to all of you, which is a very ideal caption: lifestyle modification, the mission 2020, a futuristic way of looking at things. Over to Dr. Sivashankaran, please.
And I know sir for more than 10 years, and it's a decade-long relationship, and it shows his social commitment that I have given an opportunity to have an interaction with you all. So then I was looking forward for this interaction because I enjoy your work culture. See the caption itself in your board: work, harmony at work. So then, to me, you are a set of people who convert this interaction into action. And one such is this 108 ambulance. Is there anybody from that section here, please? I will lick them a big applause, because there is something which we all longed, because we thought that it's something which is needed for Kerala. You implemented it. And now many countries are coming to India to see how effectively we operate this. So this is something which you do, and I look forward for a lot of action from each and every one of you after this interaction. So then today's discussion topic, I need to tell you why we need a mission and why it is a mission for 2020. And for that, I'll take you to a concept called 2-3-5-0. Two things: physical inactivity and unhealthy diet lead to 3 diseases: diabetes, the cardiovascular disease and cancers. And that is responsible for 50% of the today's hospitalizations and medical expenses and death. So remember this fundamental concept: 2-3-5-0. Two things: physical inactivity and unhealthy diet leads to 3 diseases: diabetes, heart disease and cancers. And that leads to 50% of the hospital admissions as of today. Why physical activity is decreasing, you all know, but I will illustrate it. And I will then go to who are the most sufferers, and why I stand before you with this red shirt, not because of any political allegiance, but to show that we are giving a red alert. And then, does nutrition intervention work, and what is this commercialized food versus heart healthy food? So this will be the brief outline of what I talk. And I will take you in the beginning, the man who landed on the moon. It was a crowning glory for our technology, isn't it? The crowning glory of the millennium of science was this gentleman walking on the moon. Every aspect of science was at his fingertips. But the same science could not prevent an heart attack in this gentleman. So you may wonder why. For that you should know when the heart attack starts. This is a cartoon of a healthy heart and a healthy blood vessel supplying blood to the heart, what we call as the coronary arteries. And heart attack happens when this blood vessel gets blocked. So this is how it starts. Due to unhealthy lifestyle, the lipids, the water insoluble substances that move about in the heart, they get deposited in its vessel wall, as you can see. So then, this which gets deposited in the vessel wall grows with you. In middle age or old age, it ulcerates and blocks the whole heart, whole blood vessel. And this much of the heart is damaged. That's the time we try to rush in your 108 ambulances to limit the damage, try to sell the house, try to sell the neighbor's house or vehicle, and to get the best treatment, but at times it is too late. So then, what did we learn from that cartoon? The killer disease of mankind as of today is the blood vessel disease. In medicine we call it atherosclerosis. This world over, this is the number one killer disease of mankind. It affects all parts of our body because all parts of our body needs nutritious blood supply. But this abnormal fat deposition begins in early life. And more than that, it allows decades for us to prevent it from growing or developing into a complication. And more than that, there are so many animals living along with us in the same planet, none of them die with this disease. Only man succumbed to this disease because we got civilized and went into this technological development. So then what goes wrong with technology will be the question in front of you, isn't it? When we do some technology, we at times ignore some safety aspects. We overlook something. I'll give you a good example. This is an example of a world where we all changed over from the incandescent lamps to CFL lamps. I think here we are having incandescent lamps again. But then when we went over to CFL lamps, we ignored one aspect, one tube lights. When thrown around, will spoil the nature by 30 milligram of mercury.